I don't regret any of it. I feel like all of the things have led me to where I need to be. In today's video, we're talking about breast cancer, surgeries, and reconstruction. I'm Marina Blackford. Welcome to my channel. If you're new here, make sure you subscribe so you don't miss a thing. I'm a two-time breast cancer survivor, and this channel is here to pay forward all the tips for you cancer fighters and survivors. So welcome. If you subscribe to my channel, you'll find weekly videos that will help you with things like chemo, radiation, surgery, but a lot about survivorship and mental health. So that's why you should come back and look for my vlogs. It's a lot of fun to just see my progress in life after cancer twice. So today's video, I want to talk about breast cancer surgeries. If you've been diagnosed with breast cancer, you have to remember there are lots of different pathology to your breast cancer. So there are different stages. People hear about other things in your pathology of your breast cancer will be whether you have a hormone responsive breast cancer, you will see like ER or HER, or a non-hormone responsive like triple negative. And so once you know the pathology of your breast cancer, that usually dictates your treatment, whether you need chemo or not, or radiation or not. And also a very important factor to your treatment is whether you have a breast cancer mutation like BRCA1 or 2. And now there's new mutations that they talk about. Having a breast cancer mutation puts you at very high risk. So it's going to be recommended that you remove all your breast tissue because you run the risk of having cancer reoccur. And I did do that, and I did have breast cancer come back. I almost hesitate to say that because I don't want to scare you guys, but I just want to stress how high a risk it is to have a BRCA mutation so that you really know that removing your breast tissue is likely the best thing to do. It sounds scary. I mean, all of this is scary. Cancer is scary, surgery is scary, because you probably haven't done a lot of this. And I just want you to know that you can do it, you will heal from it. And if you find great doctors, you can be in good hands and you can come out of this cancer-free and having exactly what you want. So, the type of breast cancer you have leads to what type of breast cancer surgery you will have. Sometimes you can just have a lumpectomy, and that's removal of that tissue where the tumor was. Another option will be to have a mastectomy, which is to remove the whole breast on one side or both. So once you know what's recommended from your oncology team, the lumpectomy or mastectomy, then you can make a breast reconstruction decision. Do you want to do an implant for reconstruction, or do you want to do a flap procedure, or do you want to just leave your breast flat? Those are all your options. If you do the implant, a lot of times it's recommended to do the gel silicone round. That's going to give you a full look, a natural feel, but compare the difference of the saline and talk to your plastic surgeon and breast surgeon about what they recommend and what seems right for you. You might also have the choice to do nipple sparing or not. And again, that's a personal choice. I can't sway you one way or another. I've had both. I've had nipple sparing and I've had a nipple removed. I'm fine with it either way. I mean, I like the way my breast looks that has the nipple. So if that's an option for you, maybe you can keep your nipple. If it's not, there are ways that they can form the tissue to look like a nipple. And if they can't, you can get a tattoo. And beyond that, there's even nipple prosthesis now that you can put on there if you want to look like you have a nipple. I mean, it's whatever you can think of, it's mostly out there now, just so you know. I highly encourage you follow me on Instagram at Marina Blackford and my new breast cancer Instagram at AZMarinaStrong. There are ones that create great bras for different types of breast reconstruction and great tank tops. So I will share that in my links on my Instagram. Look for that. Your other option is typically to do a flap procedure. And I think a lot of women are starting to look into this. DIEP Flap is the most common that I hear right now. And that stands for Deep Inferior Epigastric Peripheral Free Flap. Woo. So where they're removing tissue is from the stomach area, but no muscle is taken, which they have found to be better for healing. When they take muscle, it takes a long time to heal and can affect you more down the road. You have to understand when you do a flap procedure, you will have two incision areas, the breast and where they take the tissue from, that need to heal. You have an implant done. I do want to mention that you can also have fat grafting, which they also remove some fat from an area like your tummy or your thigh and can inject that like liposuction around the implant to help kind of get that more natural contour after having all the breast tissue removed and an implant put in your chest. The side effects are having another incision and having soreness in another area. The great thing is you could have a more natural looking breast. The downside is fat grafting sometimes takes 2 times to get the look you want because fat does tend to dissolve after some healing. So again, you have to consider what the healing time is worth for you, how important is the end results and how it looks to you. And I strongly encourage you take your time and ask lots of questions for the breast reconstruction process. The other option is to just stay flat, to just remove the breast tissue on one or both sides and not do any flap procedure or any implant procedure. That is absolutely an option. And there are great resources now to use breast forms in your bra, under your tank top, in your shirt, so that you still feel like you look like you have something when you're out doing things. And then you can decide whether you want to feel comfortable going flat or not. Guys, whatever you decide, just go at it with an open mind that you can always change things down the road. That sounds easier than done because nobody wants to do multiple surgeries. But I think if you allow yourself to think that way, then the stress of choosing will be less. I chose the breast reconstruction route for implants because I was 31 when I was diagnosed. I was dating my husband, and for me that just made the transition easier to have something. Has it been a smooth road? No, because I had a lumpectomy removed over the implant on some tissue. I got a staph infection, so I've had that implant redone, many times due to a staph infection. That was not a result of my breast reconstruction though. That was just a result of being at risk for breast cancer and needing more procedures done. I don't regret any of it. I feel like all of the things have led me to where I need to be, which is still cancer-free, living my life here, sharing information with you guys to tell you that you can do this. If you have questions about breast surgery, check out one of my videos about breast surgery tips. If you want to see my healing after a lumpectomy, I have a vlog on that. So I encourage you to kind of browse around my channel and find videos that suit you. There is a playlist that says surgery videos. So I will share that in the links down below. You want to click more under this video and you'll find it there. I'm so happy you're here. As always, thank you for listening, and I look forward to seeing you in the next video. Bye, guys.